Welcome to the body imaging cases. This is a 15-year-old girl with diplopia and ptosis, and you are provided with chest X-ray and CT of the chest. The only abnormality on the chest X-ray is probably this change of contour of the left cardiac border. Superior to the arrow, you see somehow an exaggerated convexity of the left cardiac border, and then all of a sudden at the region of the arrow you see that this convexity stops, and that's what we expect from a normal left cardiac border. However, this finding was quite subtle and we could not give it a meaning except after receiving more data from the clinical side. The data came from the serological examination in view of the diplopia and ptosis. Serological assessment of the possibility of myasthenia gravis was done and proved to be positive. So there have been antibodies specific for myasthenia gravis. This suggests, of course, that we may be dealing with a thymic abnormality. CT was ordered to assess this possibility, and it showed a lesion at the left side of the heart overlying the left cardiac border, which is consistent with thymoma. Here we see it on the coronal reconstruction, and here on the three-dimensional reconstruction we see the lesion overlying the left side of the heart encoded in yellow. So the diagnosis here is thymoma associated with myasthenia gravis, and the learning points are: thymoma may arise from the left side of the thymus overlying the left side of the heart, not necessarily from the midline of the anterior mediastinum. On the chest X-ray of a patient with suspected myasthenia gravis, attention should be given to even the slightest change in cardiac contour for the possibility of thymoma. Sectional imaging, CT or MRI, would still be the best method for the diagnosis of thymoma in patients with myasthenia gravis.